Imagine a world where the very foundation of public health is under scrutiny, and the trust in scientific evidence is wavering. This is the stark reality we're facing today. As a staggering only 1 in 4 Americans believed that the recent vaccine recommendations from the Trump administration are grounded in science. But here's where it gets even more alarming. The administration's top public health official, Robert S. Kennedy Jr., has been instrumental in upending the federal government's process for recommending immunizations, leaving many to wonder if the decisions are truly based on facts. The Reuters Ipsos poll, which surveyed over 1,000 U.S. adults, reveals a disturbing trend. Just 24% of respondents think the new federal vaccine recommendations are based on science and facts, with a whopping 48% believing they are not. But what's behind this skepticism, and how will it impact the future of vaccine access in America? To understand the gravity of the situation, let's delve into the details. The Trump administration has signaled a significant shift in its approach to vaccinations, particularly for young and healthy individuals, as well as pregnant women. This marks a drastic reversal of the historic vaccination drive against COVID-19, which was initiated by President Trump himself during his previous term. The Food and Drug Administration has already narrowed its approval of COVID-19 vaccines to adults over 65 and younger people with health risks. Moreover, Robert S. Kennedy Jr. has fired the head of the Centers for Disease Control and Prevention, Susan Monterez, and all 17 expert members of the CDC's Advisory Committee on Immunization Practices. A revamped committee is set to meet soon, which could lead to new recommendations for various vaccines. The implications are far-reaching, with many Americans, especially Democrats, worried that the Trump administration might pull back federal support for vaccines more broadly. In fact, 48% of respondents expressed concern that children might not receive the necessary vaccines in the future. The controversy surrounding vaccines is also playing out in state capitals, with Republican-controlled Florida planning to drop public school vaccination mandates, while Democratic-led states are preparing to make their own vaccine recommendations that diverge from federal guidelines. As the debate rages on, it's essential to ask, what does the future hold for vaccine access in America? Will the Trump administration's decisions be based on scientific evidence, or will politics take precedence? And this is the part most people miss. The fight over vaccines is not just about public health. It's also about trust in the government and the scientific community. So we must ask ourselves, can we trust the decisions being made about our health? And what can we do to ensure that science, not politics, guides these critical choices? But here's the million-dollar question. What do you think? Do you believe the Trump administration's vaccine recommendations are based on science? Or do you think politics is playing a significant role? Share your thoughts, and let's spark a conversation that can help us navigate this complex and contentious issue.